So without further ado, I'd like to introduce our speaker, Ms. Teresa Brennan. Teresa is a registered dental hygienist with a Bachelor of Science in Health Education. She has over 34 years of experience working with people who have intellectual and developmental disabilities. She divides her time managing a portable dental program for at-risk children in Head Start and school programs and works as a clinical hygienist for Tufts Dental Facilities. So pardon me while I pass the microphone over to Teresa and she will begin.
Thank you, Courtney. I am very excited to be here today to talk about oral health. I am hoping that you will come away from this webinar with the knowledge and confidence to become better advocates of improving the dental health of persons with intellectual or developmental disabilities. I also hope that on a personal level you will learn a fact or two about your own dental well-being. So today's webinar will cover the oral health problems associated with persons who have an intellectual developmental disability, signs and symptoms of dental disease, risk factors, barriers to care, intervention and prevention strategies. We'll review a case study and questions at the end. People with intellectual developmental disabilities are more likely to have poor oral hygiene, periodontal disease, and untreated dental caries than are members of the general population. This statistic reflects the outcome of a study implemented between April 2009 and March 2010, where electronic dental records were reviewed for 4,732 adult patients in Massachusetts who had at least one dental visit at a Tufts dental facility. The study revealed that 87% of the participants had caries experience, which are cavities, 32% had untreated dental caries, 80% had periodontitis or gum disease, and 11% had missing teeth. This analysis suggests that adults with ID remain vulnerable to dental disease, despite access to comprehensive dental services. So let's begin about talking about decay. Tooth decay occurs when an individual consumes sugar. That's the long and the short of it. The sugar plus the bacteria found in the mouth forms an acid. The acid attacks a healthy tooth and forms a cavity. If left untreated, dental decay can cause pain and unnecessary tooth loss that can lead to chewing, speaking, and digestive problems. Cavities can occur on any tooth surface. The most frequent occurrence is on the chewing surfaces of the back teeth due to deep grooves and fissures. Dental sealants placed on these chewing surfaces before a cavity starts is an excellent means of preventing future tooth decay. To place a dental sealant, a thin plastic coating is painted on the chewing surface of the tooth, and it will bond to the grooves, forming a protective shield. It is a relatively painless procedure with no Novocaine or drilling involved. Another common site for cavities is in between the teeth. Therefore, taking x-rays is a useful diagnostic tool. Cervical caries occurs when an individual does not brush properly, and this is the area where the teeth meet the gums. Therefore, it is always important to lift the lip and thoroughly brush along the gum line. It is also a frequent site of dental decay when an individual has a habit of sucking on mints or lozenges for long periods of time. Altoids are a common culprit for this type of decay. A dental abscess can occur when there is an infection in the root of the tooth. It is most likely due to a cavity that has not been restored or filled. The cavity or infection will travel down the root of the tooth and pus will collect at the site of the infection. The condition will become progressively more painful until the abscess either ruptures and drains on its own or is drained surgically. The treatment for this type of abscess is root canal therapy, when a dentist or an endodontist removes the pulp from the center of the tooth and fills the cavity with a root canal filling. This procedure can relieve a toothache, stop infection, and promote healing. As you can see to the right of the diagram, before and after x-rays have been taken on a back molar that has been treated with root canal therapy. They appear as white lines going down the root of the tooth. What does an abscess look like? It generally takes on the form of a pimple on the gum and is filled with pus. Keep in mind that an abscess looks very different from a canker sore, which would appear as a small, shallow ulcer or cut on the gum rather than a pimple-like appearance. If you suspect that an individual has a dental abscess, please contact the dentist immediately to treat the infection. We'll now review the signs and symptoms of gum disease. Healthy gums are pale pink in color, lay flat against the teeth, and fill the spaces in between the teeth. They do not bleed when they are brushed. Gingivitis is the mildest form of gum disease. It is caused by poor oral hygiene and lack of brushing. It occurs when a sticky mix of bacteria and the substances they secrete form on the teeth. This invisible bacterial film called plaque causes the gums to become infected. The gums are now red in color. They do not lay flat against the teeth and will bleed when brushed. The reason for that is that the gums will bleed. The reason the gums will bleed is because the red blood supply comes to the surface of the tissue to ward off this infection. Many individuals will stop brushing when they see blood, but it is important to continue brushing to remove these irritants that are causing the gums to be unhealthy. The good news is that gingivitis is reversible with routine dental cleanings and brushing 2 to 3 times daily. Some factors that contribute to gingivitis include diabetes, smoking, aging, genetic predisposition, other systemic diseases and conditions, stress, inadequate nutrition, and certain medication use. Gingival hyperplasia, or overgrowth of the gums, may be caused when an individual takes Dilantin, a common seizure medication, and has poor oral hygiene. Treatment for this overgrowth is to surgically cut back the gums. Ouch! Therefore, any individual taking the medication Dilantin should signify a red flag to you, for they will need to be put on a strict oral hygiene regimen. Untreated gingivitis can advance to periodontal disease, in which the toxins produced by the bacteria break down the tissues and bones that support the teeth, resulting in tooth mobility. As you can see from the slide, the gums are now red or almost purplish in color. They are not firmly attached to the teeth, and they will bleed when brushed. The most important issue is that the teeth can become loose. If you happen to notice a loose tooth on an individual, be sure to contact the dental clinic as soon as possible to avoid the possibility of choking or aspirating the tooth into the lungs. Periodontal disease is the most significant oral health problem in people with Down syndrome. Consequently, large number of them lose their permanent teeth in their early teens. Contributing factors include poor oral hygiene, poor tooth alignment, grinding, and an abnormal host response because of a compromised immune system. Signs of mouth pain can include any of the following: ear rubbing, head banging, face striking, disturbance in sleeping and eating patterns, gum rubbing, drooling, biting, chewing, or just a general feeling of unhappiness or irritability. Recognizing behavioral signs of mouth pain is important in determining if the cause may be related to oral health. Also, be aware that some individuals may have an increased tolerance to pain, and although they may be experiencing a dental problem, they may not show any outward signs of pain. Therefore, routine dental care is essential for this population. Risk factors for dental disease include cognitive impairment, physical limitations, and behavioral issues. Can you read this heading? Okay, I've given you some time. By reading the statement backwards, it says, brush in circles along the gum line. So what this slide illustrates is the frustrations faced by individuals who may have trouble verbally communicating their needs in reading written forms of communication. They also may not have any type of spatial relationship, which plays an important role in toothbrushing skills. Therefore, when determining how well an individual can brush, give them a toothbrush, and have them brush for you. 9 times out of 10, they will not have the ability to brush properly. Physical limitations will prevent individuals from brushing independently. Adaptive aids such as bicycle grip handles, rubber balls, or extension handles can make the toothbrush easier to hold and thus more accessible to the mouth. Also, the use of floss picks makes for easier removal of food and bacteria between the teeth. So there's a tremendous variation in the management of a patient with a developmental or intellectual disability. Some individuals may be able to tolerate treatment in the office or clinic setting, while others will refuse to even enter the building. TDF has developed a patient cooperation scale that they use to assess an individual's baseline cooperation level, which then can be used to track the likelihood of accepting dental procedures at future appointments. This is the evaluation key, which is part of our encounter form given to our patients after each dental visit. It depicts the patient's overall dental health, their cooperation level, and the dental provider's comments. So the following are some tried and true strategies that are used to enhance the ability for patients to receive good oral health care. Prior to the dental visit, review the individual's dental treatment history to see how they cooperated during past dental appointments. Use pictures and/or dental equipment to familiarize the individual with what will happen during the visit. Schedule the appointment to a time that best suits the individual. I know that some folks hate to be taken out of their day programs, so making an appointment before work may be more suitable for them. Communicate with the dental office staff of any concerns or arrangements that need to be made ahead of time, such as scheduling the individual with a male provider instead of a female, if that's who they prefer. Any prescription refills that need to be done, or just changes in the individual's health history. Provider continuity also plays a major role in the cooperation of the patient. Seeing the same dentist or hygienist allows for familiarity and comfort. Controlling the environmental stimulus, whether it be a country station on the radio or no radio at all, will also help in creating a successful appointment. During the dental visit, bring comfort items from home. Use verbal reassurances. Accompany the individual into the operatory. Model for the patient. Tell them that you'll show them first how it can be done, and then they can do it. Allow extra time and clearly explain the procedures. These strategies will all help to ease the anxiety. Considering sedation prior to the appointment is also another option. Regardless of the patient's needs, it is critically important to treat the patient in the most appropriate setting to manage their dental health. For those individuals who cannot tolerate dental treatment in the clinic setting, they may need to be admitted to the operating room for full mouth rehabilitation under general anesthesia. So there are many barriers which impede an individual from receiving comprehensive dental treatment. They include financial limitations, guardianship issues, fear, apathy, and lack of providers. Financial concerns present a barrier due to the fact that many individuals are on a limited income. There is also a lack of dental providers in the community setting that accept mass health insurance, which is the dental insurance most individuals are eligible for. The issues of consent, sometimes involving legal guardianship, may also present barriers to dental care, especially in the case when a person needs to have dental treatment done in the operating room. Fear and apathy also play a major role in receiving routine dental care. Many parents and caretakers can be overprotective, and as a result, they may not seek out treatment because they are afraid there will be pain involved or because they are uncertain how the dentist will react to the patient. In addition, many of these individuals are medically compromised, and the parents or caregivers are justifiably concerned that the dental procedure may negatively impact the individual's medical condition. Furthermore, many individuals may be extremely fearful of dental procedures, sadly due to past negative dental experiences. Education is also an issue. There's been a shortage of dentists and hygienists trained to treat individuals with intellectual or developmental disabilities, which makes it difficult in finding a provider close to home in certain areas of the state. We will now discuss intervention and prevention strategies. We all know that a healthy mouth makes for a healthy body. Prevention strategies include daily toothbrushing, flossing, chlorhexideine therapy, fluoride therapy, and routine dental care. Practicing good oral home care is the key to maintaining a healthy mouth. Before attempting to brush an individual's teeth, it is of most importance to don personal protective equipment, thereby the toothbrushing dress code. This includes gloves, mask, and eyewear. As I mentioned previously, 80% of individuals with a disability have periodontal disease, which means that they will bleed upon brushing. As a caretaker, you must be diligent in providing safe, effective toothbrushing for both the individual and for yourself. When carrying toothbrushing out at home, keep in mind that it doesn't have to be done in the traditional bathroom setting. Instruct the caregiver that it is okay for toothbrushing to be done in front of the television, on the individual's bed, in the shower, or even in the kitchen. Wherever it can be effectively performed is all that matters. As I mentioned before, a consistent routine is very important, so try to do it at the same time every day. Also, if the individual does not like the taste of toothpaste, whether it be mint, bubblegum, or fruit flavored, don't let that stop you. Dry brushing is perfectly acceptable. Toothpaste is mostly used for the delivery of fluoride. There are other means of providing fluoride therapy, which I will talk about later. When brushing an individual's teeth, try to be in an area that has good lighting. Stand behind the person and lean against a wall for support. Gently hold the person's head against your body so that you have a bird's eye view of their mouth. You really want to be able to see what you are doing. There are all types of toothbrushes on the market. Just take a walk down the oral care aisle at your local CVS pharmacy. It goes on and on. A manual toothbrush is just as effective as a battery-operated or electric brush. It really depends on personal preference. The key is that the correct size toothbrush is chosen and that toothbrushing technique is effectively performed. A soft toothbrush is recommended since the bristles can get between the teeth and the gums more effectively. Also, improper brushing with a hard toothbrush can result in receding gums, which can cause tooth sensitivity. Do you ever experience pain or tingling on your teeth, especially when eating sweet, hot, or cold foods? Do brushing and flossing sometimes cause you to cringe? Chances are you have receding gums. In healthy teeth, porous tissue called dentin is protected by your gums and by your teeth's hard enamel outer layer. However, dentin can be exposed due to receding gums, a fractured tooth, or even erosion. Microscopic holes in the dentin called tubules connect to the nerve, triggering pain when irritated by certain foods and beverages. Eating acidic foods and beverages on a regular basis can also cause enamel to erode, increasing the likelihood of sensitivity. So avoid acidic food and drinks, use a soft toothbrush, and brush with a desensitizing toothpaste. These will all help. As a general rule, toothbrushes should be replaced once a season or 4 times a year. However, if the toothbrush has frayed bristles, it needs to be replaced more frequently. Also, it's strongly recommended to replace one's toothbrush after contracting strep throat, a cold, the flu, or other mouth infections. The reason for this is the bacteria can harbor in the bristles of your toothbrush and can cause reinfection. This slide illustrates proper toothbrush technique. Always approach the mouth systematically so you don't miss any teeth. I suggest that you start at the lower right-hand side of the mouth and place the brush at a 45-degree angle to the gum line. With a circular motion using short, round strokes, break up the colonies of bacterial plaque and brush away from the gum line. Do this on both the top and bottom. Then proceed to the inside surfaces and brush in the same manner, turning the toothbrush the long way when brushing the front teeth. Using short back and forth strokes, brush all the chewing surfaces. Lastly, apply another small dab of paste and gently brush the tongue to remove bacteria that is caught in the grooves and fissures and may be the source of bad breath. Establishing a consistent toothbrushing routine is as equally important. A toothbrushing task analysis can be used for those individuals who can brush independently. The purpose is to divide toothbrushing into a series of steps that can be mastered over a period of time. Utilizing a process called back chaining, the caregiver will review and re-instruct the individual as necessary. However, I caution you to watch the individual closely when checking off this form so that toothbrushing is done correctly and that the individual is not just sucking the toothpaste off the toothbrush. Using plaque-disclosing products are a great visual aid in removing the colorless bacterial film from your teeth. These disclosing products contain a harmless dye that reacts with the plaque that may remain on areas of the teeth after brushing. When you see the dyed areas, you can identify trouble spots to focus on when you brush. Disclosing products come in tablets, liquid, and swab form and can be purchased over the counter at your local pharmacy. Brushing at least twice a day and flossing once a day are two of the best habits in keeping your gums and teeth healthy. You need to take about 18 inches of floss and wrap it around your middle or index fingers. Gently slide the floss between the teeth in a back and forth motion and then wrap it around each tooth, being careful not to cut the gums. As I mentioned earlier, floss picks are a great alternative to this traditional flossing practice. Remember though, flossing is only effective if built into a daily routine, preferably at bedtime. So if you are only flossing once or twice a week, you need to step it up. However, I do caution you as a beginner to use a mirror and start slowly, beginning with your front teeth and then working backwards towards your molars. Only because if you decide to start your flossing routine tonight in front of the TV, chances are you will wake up tomorrow with sore gums and will be totally discouraged. Fluoride therapy in the form of toothpaste, rinses, and varnish are all effective measures in preventing tooth decay and sensitivity. Chlorhexideine therapy, otherwise known as Paradex, is a short-term therapy for the treatment of gum disease. It is a microbial agent, and the delivery method should be based on the individual's abilities. Rinsing, for example, may not work for a person who has a swallowing difficulty or one who cannot swish and spit. Chlorhexidine can be applied to the teeth by dipping the toothbrush directly into the Paradex and targeting the gum line. Avoid using toothpaste when using Paradex because the therapeutic benefits can be weakened by the agents found in toothpaste. Lastly, routine dental care is recommended for dental maintenance every 3 months to remove the plaque and hardened plaque called tartar, for placement of fluoride to prevent cavities, and to evaluate the mouth and perform oral cancer screenings to make sure that there is no presence of disease. Intervention strategies for a healthy mouth include understanding risk factors for oral disease, eating a healthy diet, and maintaining a healthy lifestyle. Risk factors for oral disease include dependence on others for care. So this is a very important risk factor because if the caregiver or caretaker does not practice good daily oral hygiene habits, they may not be proactive in providing optimal dental care that the individual requires, whether it be in the form of daily brushing or seeing the dentist routinely. Other risk factors include tobacco use, mouth breathing, dry mouth, certain medications, age, being tube-fed, and self-abusive behaviors. Self-abusive behaviors can be exhibited by rumination, regurgitation, rechewing or reswallowing of food, pica activities of eating non-edibles, and also self-injurious actions. Sugar, both natural and added, comes in many different foods. So it is important to become better educated in reading food labels. Be aware of the sugar content in carbohydrates and learn other names for sugar on food labels. Corn syrup, fructose, and evaporated cane juice are just to name a few. Be mindful of processed foods and eat more whole grains and fresh fruits and vegetables. The amount of sugar in food products, as well as the stickiness and the time that these foods are eaten, all play a role in tooth decay. It is important to note that 4 grams of sugar equals 1 teaspoon of sugar on a food label. Beware of hidden sugars, especially in yogurt. A 6-ounce container of Yoplait strawberry yogurt contains 27 grams of sugar. Divide that by 4, and you have 7 packets or teaspoons of sugar in just 1 serving. Fruit juices are another culprit. To read the label on this bottle of Welch's apple juice, you would think that it's actually healthy. The label reads that it's 100% juice, that it contains 100% vitamin C, and there is no sugar added. Who wouldn't want to drink it? But hold on, just take a look at the nutrition label. For an 8-ounce serving, there are 28 grams or 7 packets of sugar. But the serving size is twice that amount. So you would actually be drinking 14 packets of sugar in that 1 bottle of juice. So you also need to be aware of the serving size. Don't let the label fool you. The nutrition label on vitamin water states that there are 33 grams of sugar. But again, that is just for an 8-ounce serving, or half the bottle. You actually need to multiply that number by 2 to get the accurate amount of sugar, which is a whopping 66 grams, or 16.5 teaspoons of sugar packets in vitamin water. So my suggestion is to give up the Gatorades, vitamin waters, and Red Bull and go for plain water when possible. Lastly, it is important to know that the first ingredient on the label makes it the major ingredient in the product. So you as a caregiver also need to be educated in regards to using sugar-based rewards as positive reinforcement. It is important for you to know that certain behavior modification programs can be detrimental to oral health. These programs frequently rely on foods and beverages such as pre-sweetened cereals, candy, sweetened coffee, or other carcinogenic foods to reward desired behaviors. So many of my patients can be coaxed into allowing me to clean their teeth if promised and stop at Dunkin' Donuts on the way home. Providing alternative non-sugary food rewards such as fresh fruits and vegetables, peanuts, and popcorn will reduce the susceptibility to dental decay. You also need to be cautioned about medicines that contain sugar. Liquid Abilify has close to 15 grams of sugar in just 1 dose. Therefore, it is suggested that patients take sugar-free medicines when available. But if that is not an option, make sure the individual drinks more water more often and rinses with water after taking any medicine. Also, if taking before bed, be sure that the individual takes the medication prior to brushing. Also be mindful that antidepressant medications can cause dry mouth, which makes individuals more at risk for dental decay. These individuals may need additional fluoride therapy. The frequent use of lip balm can also help to ease the strain of dry, chapped lips. So now we will review a case study. The individual is a 32-year-old male named Roger, who has cerebral palsy and a seizure disorder. He takes Dilantin for his seizures and has not seen a dentist for over a year. Clinical findings show that he has a fractured front tooth that's beginning to discolor, gingival hyperplasia or that gum overgrowth, lost fillings, and a broken clasp on his lower partial denture, but he wears it anyway. Oral hygiene habits include brushing once a day using Crest toothpaste. He uses a hard toothbrush, and he uses a denture brush on his lower partial when he remembers to take it out. His 24-hour diet recall at breakfast includes 1 cup of coffee with cream and 4 teaspoons of sugar, 2 scrambled eggs, 2 toasts with jelly, and an 8-ounce glass of apple juice. Lunch is 2 cups of microwaved macaroni and cheese, a cup of granola, a 16-ounce bottle of that vitamin water, 1 cup of mixed fruit and light syrup. Dinner is 2 cups of beef stew, a dinner roll, 1 cup 2% milk, and a cup of Jell-O. Snacks during the day include 2 cheese Danish, 3 cups microwave popcorn, 3 6-ounce servings of Yoplait yogurt, 2 cups of coffee with cream, and 4 teaspoons sugar each. Intervention and prevention strategies include routine dental appointments and cleanings, educating the staff and Roger about those side effects of Dilantin and poor oral hygiene, which will equal the gum overgrowth, possible root canal therapy on his front tooth, replacing his lost fillings, and also replacing his broken partial denture. Home care includes brushing 2 to 3 times a day using a fluoridated toothpaste. Avoid buying no-name toothpaste, especially at the dollar store. Look for the ADA seal of acceptance. It is the gold standard when it comes to evaluating the safety and efficacy of dental products. Roger should also be flossing once a day. Roger needs to remove and brush his partial denture after every meal and soak it overnight when sleeping. Denture or partial care includes lining a sink with wet paper towels or filling the sink with warm water. This will prevent breaking or cracking the denture if dropped accidentally into a hard sink. You want to remove the denture and place it in the palm of your hand. Gently hold the denture over the sink and brush all parts of the denture. Turn the denture around and brush the inside too. Rinse the denture with cool water. Then brush the gums and tongue using a small, soft toothbrush. Lastly, the USDA has acknowledged that everyone has different dietary needs based on gender, age, weight, and physical activity. These dietary guidelines can be tailored to Roger's personal needs. Roger needs to eat more fruits and vegetables, replace the morning Danish and yogurts with healthy alternatives, cut down on his portions, and limit sugary drinks. ChooseMyPlate.gov is a free online food guide complete with interactive tools to help you learn what nutrition experts say Roger should eat and how his diet stacks up to their recommendations. So important facts to remember from today's webinar include the following. First and most importantly, build toothbrushing into a consistent daily routine. If possible, use an egg timer or a song on the radio to ensure that brushing is done for at least 2 minutes. Second, be methodical when brushing so you don't miss any teeth. If the individual's cooperation level is such that you cannot brush all of his or her teeth, don't give up. Just concentrate on brushing properly those teeth that you can get to, even if it's only 1 or 2 teeth. Third, remember that routine dental care is crucial to maintaining a healthy mouth. TDF recommends 4 cleanings a year. And last, limit sugar intake, which is the main culprit in causing tooth decay. In conclusion, I hope you have learned some important dental practices that you can incorporate into your own personal lives. I also hope that becoming better informed that you can make a difference in improving the oral health of those individuals with intellectual and developmental disabilities. Do you have any questions? Okay, I have one here. Someone called in and asked, how do you address the cardiogenic rewards used in a behavior modification program, or the Sugary rewards? So, you know, what I would do for that is, especially for those folks who love their Dunkin' Donuts, I would, you know, try to cut back on the sugar. I don't know if you've ever looked at the nutritional label there, but I think on a small coffee, they put 4 teaspoons of sugar in their small coffees. So, you know, what I would do is maybe try and cut back to maybe 3 teaspoons of sugar the first week, and then the second we go to 2 teaspoons of sugar, and then kind of narrow it down to 1 teaspoon. That may help reduce the cardiogenic level that way. When buying your vitamin waters, those kind of things, go for the zero waters. That has no sugar added. Look for no sugar added products and any kind of, food or, beverages that they may like. That will also help as well. Okay, another question is, what precautions would you take regarding a patient who has a seizure disorder? Okay, well, the dental chair has all the stimuli to make a patient more at risk for a seizure. Seizures can be triggered by external stimuli such as stress, anxiety, pain, or a sensory overload, such as a bright light. So, by providing, sunglasses to our patients, lots of verbal reassurances. We use mouth props to be sure, if they were to experience a seizure while we're in their mouth, that we would be safe. And also making sure that the blood level testing of the seizure medication is done routinely to make sure that the medication is doing what it should are all good, practices to avoid that. Also, okay, another question here. What should you do if a person resists toothbrushing completely? So, what I would suggest is maybe using an oral desensitization program. And all that is, taking either a cotton ball, gauze, a washcloth, something along that manner. And for the first week, sitting the person down in front of the TV or wherever they're most comfortable and just rubbing the outside of their face for maybe, 3 to 5 minutes. Just rubbing, if they'll tolerate that, the outside of their face for the first week. Try to do it, like I said, the same time every night. And then the second week, rub the outside of their face and maybe include the lips. The third week, outside of their face, the lips, and maybe try to, touch that top front tooth. So eventually, by doing this type of thing, you will be able to get a toothbrush in there and successfully brush someone's teeth. But it does take a long time, and you just have to be very patient with that type of desensitization program. However, my other suggestion would be to send a toothbrush into the day program. Occupational therapists and other therapists would perhaps work with the individual in starting a toothbrushing program on a daily basis for them. And that will help them to become, less tactile defensive and able to tolerate the toothbrush better. So is there any difference between sugar and sugar substitutes such as sweet and low? Well, the best type of sugar is just the natural sugars that come in a product. Using sugar substitutes is a better alternative, but again, anything, I would just suggest that in moderation. I don't like, anyone to use too many sugar substitutes as well. I know we all know back in the day, for those of you who have been around as long as I have, Tab, the soda Tab, how they took that off the market. So again, everything in moderation. I firmly am a believer in just fresh fruits, vegetables, natural sugars is the way to go. Okay, so what if a person won't enter the dental office? Yeah, that's a tricky one. Not that we haven't gone out to the van just to kind of, greet the person out there or meet them at the front door. A lot of the patients who have been discharged from the developmental center sometimes don't like to come back and have their treatment done at a developmental center. So again, it's just trying to get them through the front door. What I suggest for that is just walkthroughs, no appointment necessary, bringing the patient in, having them walk through the clinic, in doing that a couple of times a month, once a week preferably, and then having them come into the clinic and maybe sitting down in the waiting room, picking up a magazine, that type of thing, until you can finally, work them into having a provider see them in the operatory or maybe in the hallway or whatnot. Will the task analysis, the toothbrushing task analysis be available? Yes. We can make a copy of the task analysis and we will send it to all registrants. But again, I do caution you, there's so many, it's like little kids. They'll run into the bathroom, they'll suck that toothpaste off the toothbrush, and you'll smell their breath and think that they've really done a good job when actually that toothbrush has never hit a surface of their tooth. Is it okay to assist someone with brushing while they watch TV? Absolutely. If they're allowing you to do it, then go for it. With the availability of smartphones, a lot of times when I am, trying to clean someone's teeth, the staff will hold the smartphone in front of them with a video or a show or something that they like, and it just kind of takes their mind off of what I'm doing. So, yeah, absolutely. Whatever helps you to get inside their mouth, that's all that counts. How long should someone brush their teeth? And should you use a timer? Yes, as I suggested, those egg timers are great. They're about 2 minutes, and, that gives you a good amount of time to be able to, cover all the surfaces of their teeth. So I think that that's a good idea. A song on the radio, too, always works, especially if they have a special song that they like to listen to, whether it be a pop artist or, a Barney song or something along those lines. Whatever works for them, if they like it, use it for that amount of time. And, I would say the minimal about 2 minutes. Okay.
Any questions from people on the phone? Well, everyone, it looks like we have exhausted all the questions. I want to thank Teresa very much for coming in today and giving us this wonderful, informative webinar. On the screen now in front of you, you see a link here to the training evaluation. If you could please, you could copy that link and paste it into your web browser and fill out the evaluation. We also have a Quality is No Accident brief that DDS developed on this topic a few years ago. And if you'd like to see that, you can download it from that box in the bottom right-hand corner that says File Share. You should be able to just put your mouse on there and hit the download, and that would open for you. And you can see we have a question there. If you'd like, we're just curious if you'd like to know more about this topic, if you could let us know how you'd like that information. And without further ado, then I think we will wrap the webinar up and just thank everyone for coming. We will post the slides on the webpage. We'll also send a link around to the archive version, and that'll go out in an email later this week to all participants. So thank you again for participating. Bye-bye.